doing this month's podcast from our busy accident and emergency department, which, looking behind me today, isn't as busy as it can be. We see about 7,000 patients every month, and recently we've had a Care Quality Commission independent appraisal and review of our department and commended us for the care that we're giving to patients. I'm also particularly pleased to be able to tell you that in August we met the national target and we achieved 95.7% in terms of those patients we saw either treated or discharged or admitted in 4 hours. And that's a huge thank you to the staff, not just in this department, but throughout the hospital and the community services that support us. In terms of the community services, what we're trying to do is work more with them to provide, wherever possible, care out in the community to allow people who maybe have a fall or some kind of illness to be treated wherever possible in their own homes instead of having to come in here to the accident and emergency department. And we were lucky enough, I suppose because we didn't achieve our target, unfortunately, in receiving additional monies from the government. We received about £1.5 million, which we're going to spend on providing new services, on increasing a number of staff, and in changing things to improve the services we can offer over the winter period. We've recently had our annual assessment looking at patient environment, food, privacy and dignity. It's now called Place, and it's very much involving members of the public to help make that assessment. And we did that work with our colleagues in Health Watch. Thank you to them for the involvement. Unfortunately, there are a number of areas where we haven't come out as well as we would have hoped for. And in particular, that's around the temperature of our food. We got top marks in terms of taste, consistency and choice, but we need to actually do something to improve the temperature. It's good to know that the Facilities Department are already working to improve in these areas, and we're looking to buy brand new trolleys to ensure that the food that is served up in our kitchens is delivered piping hot to the wards. I'd like to give you a personal invitation to our annual members meeting, which takes place this year on the 10th of October. This meeting will require us to be able to approve things like our annual report and any constitutional changes, but we want to broaden it out beyond the mandatory requirements of an annual members meeting. We're looking at trying to help you in terms of health promotion and looking after yourself. So the doors open an hour before the meeting at 5 o'clock to allow for people to have flu jabs, their blood pressure to be checked, their BMI to be checked, and we've got healthcare workers there to support you. We then start the annual members meeting proper at 6 o'clock, and it'll take place between 6 and 8. I'm so pleased to be able to tell you that the stroke team are going to be able to give you a presentation of the work they do, and you will hear firsthand a stroke patient's very own story. And then there will be the usual opportunity to ask any general questions at the end of the meeting. I do ask you to come. It's important that you come and give us your views and support us. I'm proud to be able to tell you about another Stockport first. This is an operation for removal of kidney cancer, and we're using a technique that is keyhole surgery, where the tumour cells are allowed to be easily removed by healthy cells in an area being identified through a fluorescent green dye. This is a very non-invasive technique for a major operation, and having now achieved this successfully, we're looking forward to many more operations. And following a review, we hope that this will be rolled out wider within the UK. And we have a winner in Stockport. We've got a volunteer who works on our children's wards, helping to entertain the children over the hours that they're an inpatient. His name, to most people, is Skip, but his real name is Charles Hamilton. I had to look that up because everybody just knows him as Skip. And he has won an award that is the regional award that Granada Television are involved in, and that will then go on to a Britain Talent Award later on. And so we wish him the very, very best at that national award, but well done to Skip for actually getting the award at regional level. finally, a message for those of you who are staff. We've got the annual staff survey just having gone out, and I noticed that in terms of the survey, it isn't clear the return date. Please can you ensure that you undertake completion of that? It only goes out to about 850 of our 5,700 staff, and it is on a random basis. Undertake that, please, by the 2nd of December. It's really important that you give us your views about what it is to be a member of staff here at Stockport Foundation Trust, because any areas that we need to improve upon then become part of the action plan for next year. So I do commend it to you. It really does make a difference. Thank you.